Welcome, guys. Today I want to quickly talk of eczema. Others pronounce it as eczema. So yeah, eczema. So first, subscribe to my YouTube channel and Facebook. Tutorials Abraham. Tutorials Abraham. Yep. So eczema. What is eczema? By the way, eczema is also known as atopic dermatitis. So the word dermatitis, derm actually means skin. So tit is inflammation. So this means inflammation of the skin. So eczema is basically a skin condition characterized by, very important, by itch, red, and cracked skin. So I can quickly show you. Yep, through this phone. So these are examples of eczema photos. Yes, eczema photos. Yes. So very important. Okay, so eczema, by the way, it can affect all ages and usually begins from childhood. So it usually begins from childhood. Okay, so we're going to quickly look at the etiology of eczema, like causes. So etiology basically means causes. So what causes eczema? So exact cause is unknown. Exact cause is unknown. Exact cause is unknown. But furthermore, cause is believed to be due to a combination of, genetic, environmental, and the immune system factors. So the immune system plays a key role in the etiology of eczema. So how does eczema present? So clinical presentation. So clinical presentation. So talking about basically a combination of symptoms and signs. So basically, I'm going to quickly mention the common clinical presentation. Okay, so eczema basically present as so there's usually itching. So itching. So this is usually severe and happen, knocked, meaning at night, very severe. And then there's red or brownish gray patches. So red, brownish, gray, patches. Yes. So usually, on hands, feet, ankles, neck, yep, upper chest. So upper chest, eyelids, and the researcher also, they say inside the bend of the elbows and knees. elbows and knees. So these are basically the common clinical presentation. Yep. And also there are other common presentation like small raised bumps, which may lead to fraud and crust, over when scratched. And then there's also what we call thickened, cracked or scaly skin resulting from prolonged scratching. So prolonged scratching can lead to this. And then there's what we call raw sensitive swollen skin due to scratching. Also, scratching can lead to what we call raw sensitive swollen skin. So what are the triggers? Because the exact cause is unknown. So what are the triggers? You can see predisposing factors. So number one, you have irritants like soap, detergents, shampoos, disinfectants, also we have allergies. We have like dust mites. We also have pet dander, and then we have pollen, and then mold. And also we have microbes. So microbes can also trigger eczema. So bacteria, virus, fungi, viruses, and then fungi. So all of this can trigger eczema. So also weather, extreme temperatures and humidity. So extreme temperatures and humidity. So humidity is the amount of water vapor in the atmosphere. And also food. And then food can trigger dairy products, eggs, nuts, seeds, soy product, and wheat, but not in all of the patient or all the individuals. So it depends, it varies. And also stress. So of emotional stress can exacerbate symptoms. So emotional stress can exacerbate symptoms. It also have hormones. Changes in the hormones level can trigger flare-ups. So hormonal changes can trigger flare-ups. So how do you treat or manage? So treatment. Number one, So treatment, we have moisturizers, very important. Moisturizers. So moisturizers, so to keep the skin hydrated. So we have moisturizers. So they keep the skin hydrated, to keep the skin hydrated. So examples, we have petrolatum. So you can say Vaseline. So an occlusive that helps to lock in moisture. And then we have also ceramide. So ceramide based creams. So example, okay, this there are also examples of moisturizers. And then we also have like product like shea butter. So this is an emollient. There's a group. So the first group of moisturizers, very important. Second group of topical corticosteroids. So there's inflammation. Topical corticosteroids. Yes. So to reduce inflammation and itchiness. So this reduce inflammation and itchiness. So examples of commonly used, we have hydrocortisone. So hydrocortisone is a low potent corticosteroid. So low potent, can be applied on the delicate areas such as the face, the armpit. Yes. We also have what we call so under topical steroid, this is a low potent. We've also I've got high potent corticosteroid betamethasone. We have clobetasol, etc. So under topical, those are topical corticosteroids. And also we have other topical agents such as calcineurin inhibitors. Yes. So example of calcineurin inhibitors, we have tacrolimus. So I've seen this topical application, tacrolimus. We also have pimecrolimus. How do they work this? So they inhibit the activity of calcineurin, a protein involved in the activation of T cells in the immune system. So they inhibit this. So this is a protein. So this one is involved, it activates the T cells, component of the immune system. So these two, they inhibit that. And the third group of oral medication, oral meds. So drugs like antihistamine for itching, antihistamines. You can give cetirizine, You can also give loratadine. Loratadine can give phenoxyphenadine or promethazine, Finnegan. So these are given to relieve severe itching. Yes, so the first group we have antibiotics to prevent secondary infections due to scratching. So usually may be given for prophylaxis of secondary bacterial infection, especially due to itching. So these are given for prophylaxis. So usually we give antibiotic which target the so you can say anti-staphylococcus, antibiotics. So examples, you can give amoxicillin plus clavulanate, or you can give ampicillin plus cloxacillin, or you can just give plain cloxacillin or flucloxacillin. Yes, all these they have anti-staph. Other literature they are saying you can even give cefuroxime, second generation cephalosporins, or you can just give cephalexin. Cephalexin has got good activity towards staph, I think, compared to cefuroxime. Yes, because you know that first generation, second, third, fourth phase. So as you increase from first to second, the activity towards gram positive reduces. Yep. Second, they have some gram. Third, they have high activity towards gram negative. And then fourth is a balanced, like moxifloxacin is found in fourth. Third, we have ceftriaxone, cefotaxime, we have cefdina, etc. Second, we have cefuroxime, cefotaxime, cephalexin first, cefadroxil. Yes. So these are antibiotics given. I want to quickly finish eczema because I want to do cirrhosis next. So the other group which you can give immunosuppressants, I give, especially in severe case, immunosuppressant. As you recall that there's a immune predisposition, so used in severe cases. So they can give cyclosporin, methotrexate. Yep. So methotrexate interferes with DNA synthesis, reducing the activity of immune cells. And then cyclosporin suppresses the immune by inhibiting the T cells. And then we also have thioprine affecting the proliferation of immune cells. And then there's this one, I love this drug. The name is so fascinating. Mycophenolate mofetis, mycophenolate mofetis. So this basically inhibits proliferation of T and B lymphocytes. So inhibits the proliferation. Meaning of proliferation is division of B and T lymphocytes. Yes. So we also have miscellaneous. So miscellaneous, we have biological agents. So we have drugs like dupilumab. So this is a monoclonal antibody. So this is a monoclonal antibody that inhibit the interleukin. So it inhibits the interleukin. So it inhibits the interleukin 13 and the interleukin 4 pathways, which are involved in the inflammatory process of eczema. So they are massively involved in the inflammatory process of eczema. So in severe cases or recurrent cases, they give this dupilumab. Yep. And then you also have what you call phototherapy. So phototherapy, so exposure to ultraviolet light under medical supervision. Yeah, so they can expose the skin of the patient to ultraviolet light under medical supervision. And then we have what we call lifestyle changes. Lifestyle changes. So avoid non-triggers. So just avoid non-triggers. Avoid the non-triggers. And then using mild soap and detergent and maintaining good skin care, nutrients. So you can use products which boost the skin. So you can talk with your dermatologist. So you have to see a dermatologist if you have eczema. Yes. So if you see a general doctor or general practitioner, yeah, it's good to have your personal doctor. Like in the USA, Europe, Canada, you have a primary care doctor. But your primary doctor, if you have eczema, will refer you to dermatologist, a skin specialist. And then also they recommend to use daily moisturizing, essential to prevent dry skin. So like Vaseline. Yes, this is what I had for you. So next we'll do cirrhosis. So kindly share, tell others this page, especially on YouTube, tutorials Abraham. You can email us at tutorial.consbr2024@yahoo.com. Thank you. And God bless. And God bless you for following me.